Okay. So we're just doing a little bit of mini liposuction here, and this is a Viafill fat collection system that my very good friend and colleague, Dr. Freund, had instructed and trained me how to do this procedure. It must be 14 years ago now, 2009, 2010. So anyway, shout out to him. And so fat transfer, this is collecting a little bit of fat. You can see the fat actually coming into the little tube here. This is a manual aspiration. This is what I'm doing, like tiny fat transfers. Our very nice patient here has a scar on her face that she wants to fill in, and she elected to do it with her own tissue, own living tissue, which is fat. So, you know, this is all sterile. I sterilized this area, I numbed it up before, and I just go through the belly button because there's be no scar afterwards. You know, she actually has a piercing here, a scar, this will look nothing like her belly button piercing. But this is a great way to help reduce scars, is taking fat cells, spinning them down, concentrating them, and then re-injecting them where there's scar tissue, because it has stem cells in it, and those packed in dense stem cells help heal overlying damaged skin. So it's a great way to do it. I love this also for patients who don't want synthetic fillers. I take the fat out just like this, and then I spin it down, put in tiny syringes, and reject in the face, cheekbones, lips, temples, nasolabial folds, jaw lines. So it can really go anywhere. And once the fat takes effect, you're going to have a good, 3 years of longevity at least. So, but it's a little bit of a meticulous process here, but patients do very well. You can already see I almost have 7 cc's of fat, which is great, because then that's equivalent to 7 syringes. So that adds up, right? So anyway, thanks for tuning in for this great procedure. And I'll be happy to discuss these options and other aesthetic options in my office. I love to make my patients look and feel their best, and certainly this is one way of doing that. So thanks for tuning in. Okay, so now I'm on to the fat re-injection portion, and we're going to fill in the folds here. I just filled in her scar here. Bring your head over the more. So she's numbed up. I gave her some numbing anesthetic before, sterilized the skin, and I'm just going into that fold now. And this is a 1 cc syringe of fat. I just like to just put little aliquots of fat right along that fold, just under it, and just kind of build it out. So you can see it already filling in. And this is basically purified, concentrated fat cells. I just spun it down in a centrifuge, and it just, you see how nicely it just fills it in. See the fold here? And then compared to this, nicely filled in. Scar also nicely filled in. And just a little tiny entry point here, that'll seal up in about 1 or 2 days. And once the fat takes, you get a good 2 to 3 years out of it. So it's a great way to rejuvenate the skin with your own natural tissues. Nothing synthetic about this. So it's a great way to rejuvenate things. So thanks for tuning in.